this is so close to home for all of us. So, as Sandy said, we now have the opportunity to hear from your candidates about where they stand on various cancer-related policies and positions. So before I get into the question and answer component, I just want to mention an important disclaimer that I forgot to mention earlier, that the American Cancer Society, the Cancer Action Network, and our Cancer Votes program is 100% nonpartisan. We do not endorse or oppose any candidate for any office. We are not here to influence the outcome of the election in any way. We're simply working to educate voters about the positions of their candidates. So we are certainly, we're going to try to treat everybody certainly equally and fairly here. So I want to welcome our two candidates for Congress for the 19th District, Zephyr Teachout and John Faso. If you'd like, you can both come on up to the stage, and we'll jump into the Q&A. To the stage? Well, yeah, stages. Appreciate it. Thanks. Okay. So I'm going to start with the first question about cancer research. I'll give each candidate the opportunity to respond, and then we'll go to the next question. Each candidate will have the opportunity to respond. So I picked randomly, and I'll have John go first on the first question, and Zephyr can go first on the next question. So I just want to make sure I'm close enough to the mic here. The first question, John, is, if elected, will you vote for an annual increase in cancer research funding for the National Institutes of Health and the National Cancer Institute?
Well, Scott, thank you very much, and it really is a pleasure to be here with all of you. Sandy and Linda, I really appreciate hearing from you and all the personal examples, and pleased that my wife, Mary Frances, is here tonight, also a registered nurse, and she's probably my primary health advisor. So the answer to your question, the short answer is yes, and I think that it's vitally important that we, on a bipartisan basis in the Congress, and if I'm honored with election to the House of Representatives, I will work assiduously to make sure that we do have the appropriate funding on an annual basis to deal with cancer research. And I'm really excited at the prospect of the 21st Century Cures Act. Chris Gibson has been a strong advocate in that regard, and he is someone who leaves an important legacy for all of us. But the 21st Century Cures Act is still in the balance. We expect that it will pass, and I certainly hope that it will pass with the Senate coming on board. But I think there's a real bipartisan consensus. Congressman Fred Epton, the chairman of the Commerce Committee in the House, and Diana DeGette, the ranking member, who are the primary sponsors of this in the House, have shown themselves as a bipartisan model of cooperation for how do you move forward. Obviously, cancer is not something that has a Democrat or Republican imprimatur on. It affects everyone, and your efforts and your advocacy and bringing forth the personal stories is really critical, because I know, having served in the state legislature, legislators respond to those stories from constituents, and your advocacy every year is vitally important. So I gave you the long answer. Normally when I'm giving these answers today, I'm usually saying, I'm John Faso and I approve this message. But I can tell you that I approve that message, and I will be a supporter of yours in this regard.
Zephyr, I'm going to ask you the same question.
It's no mystery to me.
Yeah, why don't you go ahead?
So the answer is an unequivocal yes. Unequivocal yes. And I do want to really applaud Congressman Gibson's efforts in this area. And then also remember the incredible work that Congressman Pinchy did as an advocate for cancer research and for access to health care. I just want to say a few things why this person too. My great aunt was a nurse at Faso, and she was married at 30, which at the time was very late. I just married at 45, which is at the time very late. And she loved her husband dearly, and he died at 40 from kidney stones. Nobody dies from kidney stones anymore because we invested in the research. It's not even considered a life-threatening illness in the same way it used to be because we invested in the research. And then this is where it gets tough. I don't know how you guys hold it back, but you shouldn't die of cervical cancer either. I have a good friend who died of cervical cancer 2 years ago because she didn't have insurance. And because she didn't have insurance, she didn't go in for regular checkups. And so she found herself at stage 4 cervical cancer, which she fought for 10 years. Beat it, and then it came back. And then she died 2 years ago. And one of the reasons I feel so strongly about the expanded coverage of the ACA is that nobody should die of cervical cancer when they've already done that research. So we need to protect that expanded coverage, and we need to do more research. And this is very personal to me, and I'm so proud of the work that you have done in raising up so many people's voices. Thank you.
Thank you both so much for your answers on that. Our next question, and our final question, is to both of you.
It's sort of like last night, except shorter.
Well, yeah. I hope a little. Okay. In a second, and I'm going to start. Zephyr, I'll start with you first. What other public policy priorities will you advance that will help prevent cancer, treat cancer, find cures for cancer, and improve the quality of life for cancer patients and survivors?
Well, I just addressed one of them, I guess, which is that I feel very strongly about universal coverage, and I feel very strongly about that access to affordable health care is fundamental. So I will defend the expanded coverage under the ACA. We need a lot more research not only into how to cure cancer, but into the causes of cancer. There's a new report out just today, although you see a series of them looking at what toxins might lead to cancer. We certainly don't know enough about that, but it's something that people in Hoosick Falls and Petersburg are really living with right now, because it was a citizen in Hoosick Falls who became aware of the heightened cancer rates that just didn't make any sense. It seemed to be way too high for a particular town. So we need to know a lot more, not only about treatment, but about causes. And I think of it as a sort of a triple barrel approach, dealing with treatment, dealing with researching causes, and then also making sure that there's adequate, affordable care. The costs, which you mentioned, are so high that they are crushing, and far too often people are left with impossible choices. I also want to make sure that we hold both encourage trials and, where appropriate, hold the pharmaceutical industry's feet to the fire in terms of the costs of drugs. And that's going to take some fierce Maurice Hinchy kind of holding feet to the fire, but that's the way that I approach this when I'm in Congress.
So I think the issue in my mind is, how do we engender speedier clinical trials? How do we facilitate the pharmaceutical industry, which our pharmaceutical industry is the finest and most innovative in the world, but also how do we bring about the kind of research done in an expeditious way? Right now, the FDA has a lot of barriers to clinical trials. The FDA, and this is something that the 21st Century Cures Act attempts to address, it doesn't listen enough to patients and consumers, and we need to have a process within the FDA that is more receptive and that is truly fosters innovation. one of the examples that I've used, that you've heard recently about the whole issue of EpiPens. And Mary Frances is a school nurse at our local high school. Every school nurse in America deals with EpiPens. You heard about the price spikes that went up from one company in the country that provided the EpiPens. Well, there's a Danish company that has the same equivalent. It's not the precise injection model, has the equivalent for $75 for a pair of the equivalent EpiPens. So I've said that if you have a country that has the type of standards and protocols in terms of drug and pharmaceutical approvals that is very similar or equivalent to the United States, and I'm talking about Germany, Denmark, Norway, Sweden, France, United Kingdom, Japan, South Korea. If you have a country that has the equivalent in terms of the approvals, then we should be much more forthcoming in our country of allowing those products into our country. Because competition is one of the most crucial ingredients in lowering the cost. A $75 pair of Danish EpiPens versus $600 a pair for Mylan's product, what are people going to buy? And what are health insurers going to authorize their insureds? And this problem with the FDA is endemic across areas of disease groups, etc. When years ago, when Mary Fran and I were a little bit younger, our kids were 2 and 7, she had, all of a sudden, couldn't breathe. Didn't have any stamina. She went to various providers, etc. No one knew what it was. We wound up going to the hospital. She had what turned out to be a malignant tumor. Had to have major surgery to remove it. And it was terrifying to us, to me as a father of a 2 and a 7-year-old, and to have my wife in that situation. It was terrifying. And so the experiences of families are broadly felt, and your experiences as you relate them to us as potential legislators are really crucial to this process. Fortunately, in our case, Mary Fran was completely cured of this, and after a lot of time, we beat it, and it was overcome. But the bottom line is that this is something that families are enduring every single day in our society. And so what can government do? Government has to be more responsive. It has to have bureaucratic processes through the FDA that are more nimble and facilitating of cures. And if it's cancer, if it's ALS, if it's Alzheimer's, whatever it is, we've got to make sure that we've got a process that is truly out of the horse and buggy age. And as Zephyr said, things that would have killed you years ago, today we take for granted. Well, hopefully we can lay a foundation so that years from now, people will be able to take for granted the kind of diseases that today we fear, and that we will search and be able to find those cures. Thank you so much for doing this today. Hors d'oeuvres.
Are we doing questions? No questions?
So you all have an opportunity to answer,
Okay.
talk to them in a second. I'm just going to wrap up a couple few more